Hello everyone, my name is Tanya Burkhart and I'm a health educator for the Oral Health Program at the CDC, or Centers for Disease Control and Prevention. I want to thank you all for taking a few minutes out of your day to tune in. Today I'll be talking about the CDC's Oral Health Strategic Plan. This is part one of a two-part screencast, so be sure to tune in for part two. Check out these statistics. 96% of Americans aged 50 to 64 years old have tooth decay. 25% of Americans aged 2 to 5 years have tooth decay. And 66% of 12 to 19-year-olds have tooth decay. These are real numbers and these are real people. Pain, dysfunction, inability to attend work, school, poor appearance, tooth loss, gum disease, low self-esteem, and nutrition problems are all consequences of leaving tooth decay untreated. Look at these reasons as to why people do not practice proper oral health. They have limited access to dental services. They are not aware that they are in need of dental services. Dental services are too expensive. And they are scared or have a fear of receiving dental services. Next, I'd like to talk about the CDC's Oral Strategic Plan, and this is an outline. So Goal 1 is to prevent and control dental decay throughout the life stages, meaning to create strategies to provide dental care to all people, young and old and in between. Goal 2 is prevent and control periodontal diseases, meaning to create strategies to provide people with oral care regarding the gums, tissues, and bones that support the teeth. Goal 3 is prevent and control oral and pharyngeal cancers and their risks. This means to create strategies to provide services that effectively detect and treat cancers of the mouth and surrounding tissues. Goal 4, eliminate disparities in oral health. So this is to create strategies to provide oral care to those with barriers such as low income, ethnicity despair, uninsured, uneducated, and residents outside of dental facilities. Goal 5 is promote prevention of disease transmission in dental care settings. This means to create and maintain infection control guidelines for dental facilities. Goal 6, increase state oral health program infrastructure, capacity, and effectiveness, meaning to create strategies to provide a state-based oral health program for all states. Goal 7, increase use of cross-cutting policy development and translational approaches to improve oral health. This means to create and provide all parties involved with evidence-based interventions, guidelines, and recommendations. And finally, Goal 8 is to ensure an effective and efficient organization, meaning that the CDC gives its word that their programs will be effective and they will do everything in their power to ensure all programs run properly. Now I'd like to tell you about how the CDC's plan addresses the nation's oral health problems. First, the CDC's plan addresses dental decay in children and adolescents with Goal 1 by creating strategies to provide dental care to children and teens of all ages. Next, it addresses dental decay in adults with Goal 1 as well by creating strategies to provide dental care to people of all ages. Next, it addresses oral cancers and disease with Goals 2 and 3 by creating strategies to provide periodontal care and detection and control of oral cancers. The plan also addresses access to preventative services with Goals 4 and 6 by creating strategies to provide oral care to those with barriers and increasing state programs. The plan addresses oral health interventions with Goal 7 by creating and providing evidence-based interventions, guidelines, and recommendations. And finally, The plan addresses public health infrastructure with Goal 6 by expanding and improving statewide programs. Does anyone have any questions thus far that they would like to share with me? This is the conclusion of Part 1 of the CDC's Oral Health Strategic Plan. Thank you all for listening today, and don't forget to tune in for Part 2.